review a little bit the hyperpigmentation, and then we will discuss new combinations, new treatment, new strategies to treat the hyperpigmentation. Okay. Okay, to decide when we will try these kind of patients, we need to identify the skin type. You know very well that the most common classification for the skin type is the Fitzpatrick classification, 1 to 6, and they have in mind the sunburn and the tan tendency and the skin, hair, and eye colors. And we have 6 items, and the first is really the people that always burns and never turns. And in the opposites, the number 6 is the black people that they never burns but always tan. Okay, this is the Fitzpatrick classification, very well known. But there are another classifications. It's the Obashi classification. And the attributes that Dr. Obashi considered to classify the color of the skin is the color, but the thickness, the oiliness, the elasticity, and the fragility of the skin. Talking about the color, he classified in original, deviated, or complex. The original is not mixed racially or ethnically. The deviated and the complex is racially or ethnically mixed. Okay, and they have different characteristics. For example, the original is very stable, and the post-inflammatory hyperpigmentation really is very rare. They need 6 weeks of conditioning before and after procedures. Okay, this kind of people with originally and no deviated and with a skin type from Fitzpatrick's, maybe 1, 2, or 3, they really is very rare that after the procedure they develop a hyperpigmentation, post-inflammatory hyperpigmentation. It's much more common in these kind of people with deviated or complex skin, because for example, deviated is weakly stable, the hyperpigmentation, post-inflammatory hyperpigmentation is darker, more pronounced, and lasts longer. They need more time to condition the skin before the procedure. And the last is the complex, that is extremely unstable. This is maybe in the indigenous people. For example, the deviated classically is the Indian people, but the complex is much more for indigenous from Latin America, for example, or people from Mexico too. The hyperpigmentation is stronger and responds slowly to the treatment, and they need much more time to prevent the post-inflammatory hyperpigmentation after the procedure. Which is the correlation between the Fitzpatrick and Obashi classification? It's very easy. This is the original 1 until 2, but is 1 the original, 6 is the original, that is the people that they suffer much less the post-inflammatory hyperpigmentation. The post-inflammatory hyperpigmentation is much more common in type 2, 3, 4, 5, that is deviated, or people with complex. Okay. This is another case that is really I like to mention, because it's another type of classified skin. There are a project that is called Humanae, and the objective of this project is to determine all possible human skin colors. And the reference that they take it is the Pantone color. And they try to identify the different colors and ethnicities with this Pantone color. Okay, we will talk about the clinical aspect of hyperpigmentation. we have many different disorders or conditions like freckles, that they are very common after sun exposures, age spots and lentigos that really that are very common in people over 40s. The hyperpigmentation induced by cosmetics or drugs, the melanosis, the real melanosis that they occur when you are using cosmetics with tar, the post-inflammatory hyperpigmentation. In the last years, the post-inflammatory hyperpigmentation is increasing a lot. Why? Why is increasing the post-inflammatory hyperpigmentation? Because the doctors are performing more procedures. Okay. This is different because when the pigmentation is after the hematoma, is because there are many it's not just the inflammation. In this case, there are in the hematoma iron. There are iron deposits. Of course, yes. Exactly. And this post-inflammatory hyperpigmentation we are seeing a lot after lasers, in this case after vascular lasers, after electrocautery, or after this kind of laser, one ablative fractional laser to perform anti-aging treatment. And you can see that the inflammation is very important, and after that, and depending of the skin type, they can develop the hyperpigmentation. And there are another condition that is really, really very difficult to treat for all dermatologists around the world, really. But there are countries like India, I think that Suba had a lot of experience in melasma, because, or Mexico, that there have a lot of experience because there are many people suffering melasma. For two reasons. Why? The first is because they are under the sun a lot of time during the year. And the second reason is the ethnical reason. Okay? Because they are from Indian or Latinos or Asian population too. For example, these common disorders are affecting 9% of Latinos and 40% of the Asian population. You understand that for the people from Asia, the hyperpigmentation really is very, very important to treat, because they suffer, but much more than this is a cultural aspect. They think that if they have hyperpigmentation, they have a low condition, social condition, okay? And this is very important in the Asian countries. It's more common in people with the skin types 4 to 6 or deviated complex skin type, living in areas with high incidence of solar radiation, obviously. It's more common in women than in men. In men, it's just 10% the prevalence of melasma. But in India, they have more men, the more higher prevalence in men. Usually symmetrical distribution and is located in forehead, in cheeks, chin, and upper lip. This is the classically location. But there are melasma extrafacial in other areas too. Okay. Which is the etiology of melasma? There are many, many factors involved. Genetic factors, the exposure under ultraviolet radiation and visible light. This is one of the most important. Pregnancy, contraceptives, hormone disorders like thyroid disorders, to take photosensitizing drug. There are many, but the solar radiation is the most important factor that induce the development of melasma. And we can take in mind that is not just the ultraviolet radiation. The visible light is inducing melasma to hyperpigmentation. And now, when we recommend a sunscreen, we need to take in mind that for these kind of patients, to avoid the hyperpigmentation, we need to give them a wide range spectrum sunscreen, covering ultraviolet, but covering visible light and infrared. But the most important for the hyperpigmentation, the visible light. Okay? Like this. The people that is in front of the PC all day is receiving the visible light too. Okay? This is the clinical pattern. You know very well that is centrofacial, malar, or mandibular pattern, depending the location of the hyperpigmentation. It's a chronic disease, it's so difficult to treat, and usually present relapses. Which is the therapeutical strategy? We need to think about which is the pigmentation process. And the pigmentation process includes the activation of melanocytes, the synthesis of melanin, and the expression of cutaneous pigmentation. There are many specific processes, proteins, and enzymes involved in the hyperpigmentation processes. There is a wide range of targets on which the agents or procedure for pigment control can act. This is the synthesis of melanin that we need with agents to inhibit the melanocyte activation, that is the first step. Then we need to inhibit the synthesis of melanin, that is all this process that Suba yesterday showed us that there are many agents that is acting in this step. And after that, to remove the excess of melanin from the stratocorneum, because when the melanin is complete, the melanocyte pass the melanin to the keratinocyte. When the melanin is in the keratinocyte, we can see the hyperpigmentation. Okay? And the therapeutical strategy in the the clinical day is to perform prevention. Obviously, is the first step to treat hyperpigmentation. Topical and oral photoprotection. The step 2 is the treatment with chemical pills and mesotherapy, lasers and light sources, topical formulations, and photoprotection again. And for the maintenance, we can give to the patients cosmeceutical treatment, because we need that the treatment for maintenance is not irritant, should be not irritant. And obviously the photoprotection. As you can see, the photoprotection is the first treatment that we need to indicate to the patients with hyperpigmentation. We talk about that the Asian population is very, very worried about this kind of disorder. This year, they put a new fashion that is to use the face bikini. This is the face bikini. But really, it's horrible. You can see to go to the beach and to meet with these people completely blocked your face with this kind of mask is terrible, okay? It's horrible. We will prefer to indicate a very good sun protector, okay? And doesn't have a bikini. It's not bikini really, okay? The first step is the prevention. Okay, we talk about to recommend to our patients topical and oral photoprotection. The daily photoprotection to avoid hyperpigmentation during the treatment and after to perform procedures is a rule. The sunscreen recommended is wide spectrum, UVB, UVA, and visible light, and at least SPF 30, at least. The efficacy of sunscreen to prevent melasma has been demonstrated in this study that is 200 pregnancy women using sunscreen. They develop melasma just 2.7%. Meanwhile, previous studies in the same population of patients, volunteers, pregnancy women, they develop melasma because they are not using sunscreen by 53%. Okay, that demonstrates that the sunscreen prevents the melasma too. The efficacy as adjuvant therapy to depigmented treatment has been demonstrated too. Hydroquinone, that is the gold standard treatment for hyperpigmentation, improved the pigmentation in 80% of the patients. But if you add the sunscreen to the treatment with hydroquinone, the percentage is that is not suffering melasma is 96%. You can increase the percentage of patients that answer very good to the treatment. There is a trend to combine antioxidants and sunscreen. The use of sunscreen reduces the free radical development in 55%. But if you add antioxidants in the same sunscreen formulation, topical formulation, you increase this reduction 20% more. The topical sunscreen could be not enough. We know very well that when you reach to the beach, maybe 1 hour after, you can put the sunscreen. And never you put in uniform or homogeneous way. Why? Because you put here, 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 and the rest, okay. And really, there is not covering the total body, okay, in the uniform way. There are trends now, and in the last Congress, the American Academy of Dermatology, that was performed three months ago in San Francisco, one of the leaders talking about sun protection, talk about that really now is necessary to complete the topical photoprotection with oral photoprotection. And he talked about the fern block, that is a new ingredient, but it's not new, have 15 years of studies, and is the fern that demonstrate improving the results of topical depigmenting treatment. Is the first oral photoprotector with scientific evidence. Which is the treatment that we can offer to the patients? We can offer chemical peels, always talking about the superficial peelings, phototherapy like erbium laser, switch rubbing, neodymium yak, IPL, or phototherapy PDT, like PDT. And depigmenting agents, that is the most common treatment for the melasma and other hyperpigmentation conditions. This is the chemical peel. The most effective chemical peel to treat the patients with melasma and other hyperpigmented conditions is the glycolic acid, is alpha-hydroxy acid, because we need to put something that is softer than deeper penetration. Okay, salicylic acid have minimal benefit, and I saw very good results with TCA, chloroacetic acid, using 10 to 15%, and really is very effective pill to treat the hyperpigmentation. Yes, it's more effective than glycolic acid, but sometimes, and depending on the skin type, you can have hyperpigmentation after the procedure, depending. But really depending the formulation of TCA, yes, because for example, I am using the Obashi formulation with TCA, and really I had very good results. And I talked with him, and he hadn't really many cases of hyperpigmentation. He hadn't. Okay. The other treatment that we can offer is IPL. This is before and after. The IPL is very good for when you want to treat patients with photoaging signs, like lentigos. It's really very good. The PDT, the blue light photodynamic therapy with aminolevulinic acid, has been used in patients. I have not a lot of experience with PDT. The laser have controversial results because maybe sometimes there are more hyperpigmentation after the procedure, post-inflammatory hyperpigmentation, depending, again, the kind of laser that you use. And the depigmentination is the most common treatment that we use to treat the hyperpigmentation, okay? And remember, you can act to inhibit the melanocyte activation, this step. You can inhibit the synthesis of melanin, this step, that the most common are the tyrosinase inhibitors, and to remove the excess of melanin from the stratocorneum, that the most common is to use exfoliation, like retinoids, like alpha-hydroxy acid. The depigmenting products represent 20% of the European market and 35% of the Asian market, and in values is approximately $20 billion. Okay, it's amazing, amazing market. This is the anti-aging, the depigmenting agent. I don't repeat because Suba yesterday mentioned all of them, an excellently, very excellent presentation, and I didn't repeat. Yes, you can see that there are many of them. Some of them, they are acting very well, and others so-so. Okay, this depends on the experience of each of them. But we can recognize that the gold standard for the treatment of hyperpigmentation is the hydroquinone, the retinoids, like retinoic acid or retinol, and the Klickmann formulation. Really, this is the most used and really the gold standard. There are coming new products like N-acetylglucosamine, tranexamic acid orally, that is really coming now, and anti-inflammatories like corticosteroids or natural anti-inflammatories, they are using a lot. The hydroquinone is the gold standard. We can use to 2 to 5%, but the side effects is the irritation, redness, contact dermatitis, post-inflammatory hyperpigmentation too, and the ochronosis. The ochronosis really is very controversial. There are countries that say that there are high prevalence, and other countries that say that is very low, the prevalence of ochronosis, like in USA. Okay, but if you use for a long time, really is controversial. And there are some countries in Europe that the use of hydroquinone is not allowing. Okay, that is banned. The retinoids takes long time to achieve the efficacy as unique therapy. That's why that always combine retinoids with hydroquinone, okay? And better results we obtain. But the side effects in 88% of the patients is the irritation and maybe the post-inflammatory hyperpigmentation. Okay. One of the most formulation used is the Klickmann formulation that demonstrate efficacy after 3 weeks of treatment with less irritation because in the formulation, the triple combination have a corticosteroid. The topical, remember, the first line is the topical therapy. After that, we can put the procedures, but always the first line of therapy is topical treatment. The topical photoprotection always must be an essential part of the treatment. Even more, the oral photoprotection is demonstrating efficacy in the hyperpigmentation disorders. And after that, we treat it to the patients. We need to maintain the improvement of the hyperpigmentation. Really, there are not enough studies published talking about the maintenance treatment. The maintenance, for example, with the triple, I treat the patient with the triple combination, and then after that, it's recommended during 6 months after the treatment to establish the maintenance treatment, using, for example, the triple combination just twice a week as maintenance therapy with very good results. The objective of maintenance treatment is to prevent the relapses after the treatment. That's why it's very important to choose non-irritant treatments and prevent the hyperpigmentation with daily sunscreen. Okay, this is the conclusion. Step 1, sun protection. Step 2, the topical formulation, and we have a lot of agents, depigmenting agent. And step 3, procedures, chemical peels or other kind of procedures like IPL, depending of the type of the hyperpigmentation. And the last point is, which is the innovation in the therapeutical of hyperpigmentation. We talk about the triple combination. This is the triple combination that is called Kligman formulation. This is the Kligman formulation modified that is based in hydroquinone 5%, dexamethasone, and tretinoin. This product that is called Triluma is one of the first used in USA and other countries that have this composition. Really is very effective, and you can reduce the irritation by the hydroquinone and retinoid by the corticosteroid, but really, even that maybe results very irritant, okay? And you need to reduce the time that you indicate the use of this triple combination. Not more, is possible, not more than 3 months, okay? The side effects is something that we don't like when we treat hyperpigmentation. We need to avoid this side effect. That's why that we need another kind of triple combination with active ingredients and technology with less side effects, better tolerance, and without the risk of post-inflammatory hyperpigmentation. And I show you a new cosmetic triple combination. This is a cosmetic and non-irritant triple combination that is based in retinoids, in a new retinoid that is patented, that is retinosphere technology, that is based in hydroxypinacolone retinoate and retinol glycosphere, cosmetic with intense depigmenting activity that are acting in this part of the synthesis of melanin, like N-acetylglucosamine, that is one in this moment important agents, depigmenting agent, kojic acid, nitric acid, albatine, niacinamide, and obviously with anti-inflammatory properties, but is preferably not use corticosteroids in the formulation. We put another anti-inflammatories that is natural products like portulaca extract and vis-a-vis. And obviously, we need to use the sunscreen. This is the retina sphere technology. It's a cosmetic tool composed by hydroxypinacolone and retinol. The most important, hydroxypinacolone retinoate, is a new ester of the retinoic acid. This new ester of retinoic acid is acting exactly in the same receptor that the retinoic acid is acting. That's why we have exactly the same efficacy that we obtain with the retinoic acid, but with better tolerance, because don't induce irritation and don't induce photosensitization. This is one of the first studies performed with hydroxypinacolone retinoate that demonstrate no irritation or sensitization in the patients. The other part of the retina sphere technology is the retinol glycosphere. You know very well that there are in the market many products with retinol. And the opinion of the doctor is some of them works, some of them doesn't work. And why? Because the retinol is very unstable particle, molecule. And this molecule you need to put inside of a delivery of a vehicle that penetrate the skin and then penetrate the retinol into the skin. That's why we use glycosphere, that is chemically stable particles that improve the penetration of the retinol, but that maintain the stability of retinol inside the glycosphere and protect the retinol from external agents. Just the light involved to the retinol to be unstable. Just the light, okay? And the conclusion is that retina sphere technology, the mechanism of action is exactly the same that the retinoic acid, because it's normalizing the proliferative epidermis, inhibit pro-inflammatory cytokines like AP1 and NF-kappa B, inhibit the expression of metalloproteinase, have anti-inflammatory properties, and have anti-aging effects. Okay. Which is the advantage of this technology, this new technology, versus other retinoids that is better tolerated in all skin types, is no photosensitizer, higher compliance to the treatment. This is very important because when you indicate to the patients some products that have side effects like irritations, the patients say, okay, no more because I not feel very good with my skin with this product, and stop the treatment. And if you stop the treatment, you don't have good results, okay? And you need to have higher compliance to obtain better results. The combination therapy with other active ingredients results less aggressive, and I have very good tolerance and efficacy if you combine with other kind of procedures, like chemical pills, like IPL, okay? And just to finishing, I show it briefly the clinical study that we have with this technology. This is one of the first studies that was performed in Caucasian and Asian women. During 2 months, the patients was using the formulation called Neoretin, and after 60 days, the clinical improvement was observed in 60% of the patients and Caucasian patients and 80% of Asian patients. And the pigmentation intensity with measurement by mexameter and colorimeter. This is the result. The skin tolerability was to be very good by all subjects, both Caucasian and Asian patients. The conclusion is that the clinical improvement was observed in 70% of Caucasian patients and 80% of Asian patients, with very good tolerability and high compliance. You can see in this photograph that is a photo from the reveal machine, and you can see that diminish the global pigmentation a lot. This study was performed in Ramon y Cajal Hospital in Madrid, and the researchers treated 30 patients to determine the efficacy of this new triple combination versus vehicle in the treatment of melasma in this case, and evaluate the safety of the product. It's a double-blind, randomized, split-phase vehicle control study in 30 patients, and they used the new combination during 90 days, 3 months, okay? And this is the parameters that we take in mind to develop this study. But the most important, when you want to see what happened in the melasma, if the patients are improving, is to measure the MASI. What is the MASI? It's the melasma area and severity index. If you can reduce the melasma, the treatment is effective. If you can reduce the MASI, the treatment is effective. Which is the result in this case? In this case, the improvement of patient perception was very good in 60% of the patients. The improvement perception by the investigator really was intense improvement in 60% of the researchers on the treated side versus 42% on the vehicle side. And the degree of improvement has been significant if you compare with the vehicle side. For example, this is pre-treatment and this is after treatment. You can see the global pigmentation is reduced. You can see the MASI parameter. This is the melasma area and severity index, and you can see that is really decreasing after 3 months of treatment. The reduction of MASI in the people treated with vehicle has been 55%, but the people treated with the new combination has been 74%. And you can ask me, but the people treated with vehicle reduced the MASI in 55%, a lot. Why? Because they was using, by ethical reasons, they are using sun protection. Okay, and you reduce with sun protection, you reduce the MASI too. This is the end of the study, the improvement of the MASI with the reduction of 74%, the patients, the pre-treatment and post-treatment. The side effects really was few and mild adverse events, and no patients stopped the treatment for side effects. The tolerance has been very, very well tolerated. Even in a skin sensitive, in sensitive skin patients and in a dark phototypes too. The conclusions is that the site treated with the new combination showed significant MASI reduction and the end of the treatment, 74% versus 50%. But the most important is that the speed of bleaching effect has been significantly faster on the site treated with the new combination than the vehicle side, 53% versus 36%. The depigmenting effect on the vehicle side is justified by the cream with SPF, of course, and the treatment tolerance was very good even in patients with sensitive skin and dark phototypes, and the treatment tolerance is much better than other depigmenting formulation. Is new, effective, and very well tolerated lightening treatment. This is one of the last study that we performed that was performed in Filipino women, and really, as I commented before, they are very worried about the hyperpigmentation. And in this study that really was finishing 2 months ago, the objective was in 80 patients to treat what happened when you compare topical treatment, placebo, active topical treatment, placebo topical treatment, the active treatment plus orally supplement, and placebo orally and topical. And really, this is 80 patients. This is the groups that I commented recently. And you can see the most important, talking about the hyperpigmentation, is the brightness and lightening. And you can see significant increase of skin brightness in all groups with active ingredient versus placebo after 30 and 90 days of treatment. But the oral and topical combination increase the skin brightness more and faster than the other regimens. For all parameters is the same. The topical treatment is very important, but if you add oral supplement with depigmenting efficacy, you can reach faster results.
Dr. Maria,
yes,
must finish.
Yes, I'm finishing now. This is the last, this is the clinical results. We can see, this is the improvement, okay? The baseline and after the treatment. Okay, it's just the take-home message. It's very important to keep in mind not only the skin color, but also the ethnicity before to start the depigmentation treatment. The first line is the triple combination, but is more effective if it's not irritant. Okay, that's why the new triple combination with cosmetic ingredients that is not irritant is one of the future treatments for to improve the hyperpigmentation disorders. Thank you. I'm sorry, I am emotional when I talk about that.
Thank you, Dr. Maria, for your excellent presentation.